Perfect, I'm back. I'm expecting my first student is Johan, but at this moment he's late. So let's wait for him and let's have some patience. I think he's gonna come. Hey, he came now. Hi, Johan.
Hello, Miss. How are you?
Hi, how are you?
I'm great. Thank you for.
Okay, that's great. So let's start the workshop. First of all, from yesterday, any question you have, something you would like to practice, to check again?
Yesterday, oh, I don't think so. I think everything was clear. Of course, I had to review it. And I had to check it out.
Okay. So if there is no problem, we can start with the checking homework, right?
Yeah, I think I sent it later, like.
Yes, few hours late, but there's no problem. You did it. That's okay. It's better to send late than not sending homework, right?
Yeah.
Yes. Can you watch my screen?
Yeah, I'm watching right now.
Perfect. We have the referral letter. Just grateful if you would see this with your assignment who has been having a headache. Perfect. Everything passed perfect. Depending on taking painkillers, symptoms suggested hypertension. Bye. Much. Perfect. That's okay. That's a good referral letter. Just organizing a little bit, but that's okay. I'm going to send you the answer for having a better idea how to organize this this referral letter, okay?
Perfect.
Questions, what are your symptoms? Okay, moreover than headache, that's perfect. When do you feel worst? Perfect. How is your health generally? Could be. In which part of the head is your pain? As a very important question. Do you drink alcohol? Could be. Do you have family history of anxiety? Diagnosis, anxiety and hypertension. Hypertension and the last name of hypertension maybe.
The last name.
Yeah, it's a hypertension, of course, hypertensive case, but it's a crisis. It's a stage 1, stage 2. It's a chronic hypertension. How could you classify it?
I don't know how to say it in English because it's not the first time that the person get the diagnosis of hypertension. I think it's debutante in Spanish. I don't know how to say it.
Tell me in Spanish.
Debutante.
A debut. It's the same.
Yeah.
Hypertension debut.
Yeah, well, we have to take another measure of the blood pressure because we have to have two elevated measures of the blood pressure.
Yeah, we have to confirm if he has hypertension with a chronic disease without a diagnosis, or maybe we have, as you say, a debut. But considering these values, 170 and 110, do you consider it's a chronic? It's a crisis. is right?
Yeah.
Because with these values, we say that he's an hypertensive patient with a crisis, hypertension crisis, right?
Yeah.
Let me get it big.
Padre.
Now, is that okay? Can you read this?
Yeah, burn.
Okay. Of course, I'm going to send you all of these answer. Next question. Your questions are okay. I like them. They're oriented to get the situation, and that's perfect. About the findings, of course, we have to remember the symptoms and signs, okay? The patient didn't say anything about signs of strokes or vision loss or heart failure or heart attack or something extra. So that's why you have to ask for about, do you have chest pain? And that question about where the headache, where the head, do you feel worse pain, to specify the site, the place, it's perfect. Because you can infer what kind of headache is. Maybe it's a migraine, not a hypertension, maybe the anxiety and migraine, and it's a chronic case, and the patient never known about these values, and they are normal for him. Normal, I mean. He usually has these values. I had a patient who has 190 and 110 as a normal BP. But of course, he was a chronic patient without diagnosis. And we got it as a diagnosis when we found the renal failure, chronic renal failure. So it usually happens in our countries. We need to consider these kind of questions for making about it, but your questions are well asked, I mean, are well done. Well, atherosclerosis, blood vessel damage, the blindness. You didn't ask anything about vision, and that's important in a hypertensive patient, right?
Yeah, that's true.
Do you remember when we were checking the class about the basic examinations? We were talking about fundoscopy, right? The ophthalmoscopy. Yes,
yeah.
that kind of findings are important in order to get if it is just a crisis, a reboot, or maybe a chronic situation. And then you have more data for explaining, for going ahead. More symptoms or signs, for example, no, that's treatment. It was for tomorrow, but that's okay. For example, signs of heart failure. Do you remember some of them?
Heart failure, yeah, of course. Edema, dyspnea,
The dyspnea, right?
Edema, and sometimes
In the low limbs, right? The lower limbs with edema. Or, yeah, what more?
Which one? What did you say?
The edema in the lower limbs.
Edema. That's the word that I was trying to say. Edema.
Okay, perfect. Don't worry. So any other signs? What are the most classical signs of hypertensive crisis? Moreover than headache. Different from headache.
Tinnitus.
Yes, the tinnitus. The blurry vision.
Yeah. Loss of vision. How you say it?
Blurry.
Blurry.
Yeah, blurry vision. Let me write it down here.
That means visión borrosa.
Yeah.
Blurry vision.
The blurry vision. That's a very important sign. The blurry vision is showing us that there is a loss of vision from the retina, right? That's why the fundoscopy is going to help you to confirm if there is another kind of damage, I mean.
Perfect.
You have here a list of end organ dysfunction or the organ dysfunction, just for having an example. We didn't ask about epistaxis, right? About that bleeding from nose. So that's important. Maybe a few days ago he had this symptom, maybe sign, and we didn't check it. So that's just for remembering. It's not for evaluation. For getting the idea that we have to be creative. Your questions are well oriented at the beginning, but according you are getting findings during the physical examination. You have more questions to do. Let's compare the case report, okay?
Okay.
Usually, when we make a case report, we don't write down the full name, just the capital letters, the name and the surname, okay?
Okay.
52 years old, security guard. It's important to get the occupation for having all the laboral risks, okay?
Okay.
Came to the consultation room complaining of intense headache. He has been feeling headache before for 2 months while increasing the coffee consumption. And that's all. That's all he said. We can add here, at this moment, he said, this pain was the worst ever. And that's all. Sorry, my handwriting. Vital signs report, all the values you have. And in this part, you don't have to forget the Glasgow Coma Scale. He is awake. He can tell you everything, right? And when you make the case report, you have to write down the explanation of the Glasgow Coma Scale in order. The one who's gonna read, now you prepare, you evaluate all the spheres, of course. Diagnosis, hypertensive crisis, and that's all. Anxiety could be, but first of all, you must control the hypertension, right? About labs, which ones you would like to ask for?
About symptoms.
No, about labs, laboratory tests, or
laboratory tests. Maybe creatinine.
Yeah.
And this let's see, creatinine. I think just creatinine and electrocardiogram.
ECG, right? ECG. So for the tomorrow we are going to talk about treatment, okay? So for the next workshop, you are going to complete labs and the studies for your patient, okay?
Perfect.
Everything you want to ask for, X-rays, MRI, I don't know, it's your creative now. You have to be creative and ask for all the things you consider necessary for your patient. Tomorrow we are going to talk about treatment, and then you add the labs and the studies, all the evaluations you must need, and you propose a treatment. Okay?
Okay.
Take action. Okay. About the referral letter. Dear doctor, I will be grateful if you will see this 50-year-old man who has intense headache. He described the pain was the worst he had been suffering from yesterday morning without receiving relief while taking analgesics. The painkillers is a social expression, a very common expression for non-medical people. Analgesics is just for us, between us, but it's a normal expression, okay? At this moment, the vital signs and the Glasgow Coma Scale, and the diagnosis. And thanks a lot. And that's all. You made a good job. I like it. That's okay.
Thank you.
So don't worry if it's late. I sent a deadline, but lots of people send me the homework until Sunday night. So there's no problem. I'm not going to take a mess like that. So in that way, as I was telling you, don't worry. You are doing a good job, okay?
Thank you.
So
yes.
Can you fill the pool, please, Johan?
Yeah, of course.
Okay, thank you so much.
Okay, thank you.
Okay, so I'm going to send you the topics of the homework, and for the next workshop, we are going to work about it, okay?
Thank you. Bye-bye.
Bye. See you, Johan.
Yeah.
Hi, Fabi.
Hi,
Hi, how are you?
a little bit busy. The last night I didn't sleep anything because I got like 3 exams for today.
Oops. You feel okay? Or everything's
Yes,
okay? I think we
yes.
can work on it, okay?
Mhm.
Okay, so let me open the case report from yesterday. Something you would like to talk about?
No,
Oh.
everything was clear.
Clear and going to the point, right?
Mhm.
Okay, can you watch my screen?
Now, yes.
Yes, perfect. Okay, we know the case, yeah, we know our patient. Poor Bernardo, yeah. Okay, all the questions you consider necessary. What is your health generally? Could be how many cups of coffee do you drink? Do you drink daily? I mean, exactly what do you want to know about this?
Okay, he says that since he was working at night, he was drinking more coffee and then the headache begin. So maybe could affect.
Okay, so how many cups of coffee do you drink? Since you are working, you can add and correct it. Maybe completing the questions. Because if you ask how many cups of coffee do you drink and that's all, the patient is not gonna to understand the idea about this question. He's going to say you, well, what you mean, yeah? So try to go specifically to the point, but that's okay. Do you drink alcohol and how often? Okay, what painkillers perfect? That's a very good question. That's perfect too. Okay. All the findings. That's an interesting way. Now, based on blood pressure, hypertension, okay. You have tachypnea, okay, could be. With all information you got, okay, the case report. There's no more findings to describe. Maybe when you have these cases, and it's gonna to be helpful for you during the whole career, almost in some tests, some evaluations during the career, you just receive very similar information. And they tell you, okay, write down all the findings. So you have to imagine all the things you can check in your patient and all the things you are supposed to find. Okay, from every system, neurological system, on skin, on cardiovascular system, on the renal system, I mean, everything you could imagine your patient may have, not just from the case. That's the idea of this job. That's why I was telling everybody to be creative about the findings and the questions. So that's okay for me if you write down this part. And of course, you are starting during the medical school. So that's okay for me. And you're using abbreviations. That's the best. Let's see the case report. Man, in more common days due to his work at night. Pain of headache that is increased. Is not this with painkillers. Okay. During taking the vital signs, it's possible to pretend the kid or more noise. That's a good case report, but you are proposing evaluations, and that's not the idea in a case report. Okay. But that's okay. The referral letter, to whom it may concern. Okay, in this topic, to whom it may concern, it's better for lab tests or for sending a report, for example, an endoscopy report, okay?
Okay.
But for making a referral, it doesn't matter if you don't know which one is going to receive it. Always write down dear doctor, okay? Because it's a colleague is the one who's going to check the patient, right? It doesn't matter the name. The dear doctor is the key for having a good contact, a good relationship with your colleague. I'm referring Rocha. The reporting. Okay. So you're going to send the patient to which area? Which specialist is going to evaluate the patient? According to this,
It's a neurologist.
okay. Who's more? Which one could be better for treating the hypertension?
Vascular doctor.
No, a cardiologist.
A cardiologist.
Another one that is well prepared, can make a grateful job. Internal medicine. We say physician, right?
Yes.
The first one is the physician, the second, the cardiologist, and the last one, the neurologist. If you are talking with a neurologist, you're looking for some complications, right? And that's okay. Yes, more tomorrow's to work according to the evaluation. Hypertension and tachypnea. Well, when you make a referral letter, you can add the vital signs, okay? For example, let's go up. Well, about the findings, well, possible questions, the ones you are asking for me are okay. That's okay, there's no problem, but we must consider to talk about the blurry vision, for example, if there is the possibility of having this symptom and the patient didn't describe at this moment, the tinnitus, the edema in low limbs, okay? And many other situations that we have to look for. And while we are evaluating the patient, we can ask for them, and that's okay. As I was telling you, you're starting, so that's not the key point to evaluate or to see the medical knowledge. No, there's no problem. Just using the correct vocabulary. Findings, okay. Of course, the patient has a 50-50 GCS, Glasgow Coma Scale. He's awake. And we have some of the symptoms, right? Symptoms about heart failure, maybe a stroke, vision loss, heart attack, kidney failure. So we must ask for these situations. And we must consider the damage we can receive to these organs, okay, with the high BP. And we have more situations to consider in this part, of course, with the acute myocardial infarction. He is 52 years old. He is stressed. He might be so low, right? If it's a infarction in the diaphragm phase of the heart, he might confuse it with gastritis. It usually happens. And it depends on your vision to check the patient with the studies he might use for, okay? About the referral, well, let's compare yours with mine. Dear doctor, I would be grateful if you see this 50-year-old man who has intense headache. He described the pain as the worst he's been suffering from yesterday morning without receiving relief while taking analgesics. No painkillers. Try to use more medical terminology. Something very technical, I mean, okay? At this moment, the moment you are sending the referral, his vital signs are, and you send all the values, including the Glasgow Coma Scale, okay? The diagnosis, and that's all. Thanks a lot. And that's all. It's a very brief letter, including all the symptoms, all the findings. Of course, I'm writing down just the ones we were talking about in the written section, but we can complete it. according to the findings we have, okay?
Okay.
Okay, about the homework from the for the next workshop, we have to talk about all labs and all the studies you consider you would ask for your patient, completing all the information we are talking at this moment. And tomorrow we are going to talk about the treatment, okay?
Okay.
So considering these two presentations, the one from yesterday, the one for tomorrow, you can complete the homework for the next workshop, okay?
Okay.
I'm going to send the homework and some more details to add to this, and then you could know what to complete, okay? So don't worry, for me it's okay. You did your homework on time, and that's perfect. And any question maybe you have about it?
No, everything is clear.
Okay. So this is a very brief, a very huge approach about hypertension. It's a very interesting topic to study, to look for, and to prepare. And it's a very, very, very common situation to get patients in this same case. I have a patient who has a usual BP around 190 and 110. And that patient never knew he was on hypertensive, a chronic hypertensive situation. And we got the diagnosis when he was with a chronic renal failure. So while looking for the dialysis and everything we needed, then we could find the diagnosis and try to do everything, but it was too late for correcting the situation.
Yes.
Finally, he did. There was no other way for finishing this part, but we didn't have any option for helping him. We tried, but sometimes here in Bolivia, it's not possible. So that's why when you make your referral or you ask someone who's gonna come, here in Bolivia, you're going to learn that you have to follow some steps. Which one is the first, the second, the third, the fourth, and if you break these steps, if you jump one from the first one to the fourth one, for example, it could be a little discomfortable situation just for you. I tell you by experience, because they say you are not following all the protocols. So what's going on with you? And you say that. Relax, you are here. Let's treat the patient. And they say, no, that's not possible. Can you watch the diary pool?
Yes, I'm doing it right now.
Okay, thank you so much. I didn't ask you which university you're studying for.
I applied for UMSA by first, but then the beginning of this year, they were like, I don't know, the Sunday will be the second exam. Okay, I was preparing myself to do the exam, and they say, not in 1 month, in 1 month more. And I was like,
They were
oh no.
prolonging. They were changing times. Yeah, it usually
So
happens.
I begin the university Nuestra Señora de la Paz.
Okay, that's a good school.
Yes, and I think I have good doctors who are teaching me, and they are so kind.
Yes, I made an upgrade there, and that's a good university. Great, that's a good point. Even though it not depends just on the university, it depends on you, how prepared you want to be. I tell you by experience. So read a lot, and that's all for at this moment. That's all. We are going to meet tomorrow with the treatment presentation, okay?
Okay, so goodbye, have a good night.
Goodbye, Fabi, see you. Hi, Belkin.
Hi.
Hi, how are you, my friend? Everything's okay?
Yeah.
Perfect. Perfect, you're always smiling. That's the best.
I'm trying.
Yeah. My dear Valkin, any question from yesterday, maybe?
No, I'm very clear about yesterday.
Yes, I think everything was okay, right?
Yeah,
It was not a
it's very
long
comprehensive.
presentation, and we have enough time to
You made
practice
a
with it.
diapo very, very, very simple.
Yes,
Yeah, simple
I'm
for
doing my
understand.
best. I'm doing my best.
Yeah, that's
Please
what's
believe
good.
me.
Very, very clear.
I'm trying to get just the point for preparing this
Yeah,
situation.
was too easy for to comprehend.
Yes, easy for understanding and getting the topics, the most important topics, right?
Yeah.
Okay, so give me a minute. I'm opening the homework. Yeah.
Yeah.
Okay. Let me share the screen. We have the case 2. That girl who was suffering from in the hospital without papers, right?
Yeah,
Yes, this
what's
one
the
is
number
yours.
2? Yeah.
The
I
number
feel
2,
I didn't have
perfect.
too many data to work, but I tried my best doing this.
Yes. The idea about giving you not too much data was to check how creative you are asking for and getting information on the global vision about symptoms and signs you are looking for. Not for evaluating medical knowledge, that's not the objective. The objective is to check the use of the terminology we were studying in the module 1.
Yeah.
One of your classmates sent me lots of symptoms and signs, but in Spanish. And I said, what? It must be in English. And when we were talking in the, well, I asked him and I said, why you send me in Spanish? Try to correct it. You have time until tonight. He told me, okay, but can you help me with the translation? Oh my God, no, you have all of this in the slides. Check them. So that was the idea. But very, very funny situation. Okay, let's read it. Here are the GP on shift. There is a diabetic patient. Okay. Okay, you have the vital signs that are very important at this moment, right? And that's what the patient is analysis. Okay, completing the questions. Why are you coming to the hospital today? Perfect. How long did you start with the diabetes? Perfect. There is a
I
pulmonary
thought a lot of
illness.
things.
Perfect. That's the idea. When you write down the questions and the first time, when you are in a real situation, it's an easier way to work on. You have the idea, you have the question done, and you are not translating at that moment what to do. How do you feel?
We say here in Nicaragua, you need to try to drive the situation. Think your patient is a car, you are the driver, so you need to drive the situation.
Yes. Perfect. We have pelvic surgery. Okay, could be last blood glucose test. That's a very good question. When do you receive your last blood glucose test? Did you remember your result? And this is lying down. You're perfect. They're very good questions. Good for me. All the findings, low pressure, fever, tachypnea, according to the vital signs you have in the information chart. But if you have these vital signs, which physical signs you expect to find? For example, on skin, if you have a diabetic patient and with that kind of vital signs, of course you consider that he's in sepsis, and that's okay, your diagnosis. That's perfect. But which ones are, according to your physical examination, which are your clinical?
Well, I thought it's a diabetic patient. the urinary tract infection is very, very common in the diabetic patient.
Yes, the most common situation, right?
Yeah. Could be diarrhea, dehydration via diarrhea, because I think his femur, she's femur, well, the low blood pressure maybe could be this I can't pronounce that. The
Tell it in
hydration.
Spanish and then we can.
Deshidratación.
With dehydration.
Dehydration.
It's complicated.
Yeah.
Dehydration. It was hard for me. I admit it. It's not an easy situation. Okay. The urinary tract infection is the most common, as you said, and that's a good idea considering she's a girl, a female that is in this situation. Of course, she's in sepsis, but when we were talking about infections, I showed you the sepsis and the septic shock, right?
Could be the septic shock.
And in this case, checking just the labs. You could talk about the septic shock.
I asked to her so because I thought could be sepsis secondary to surgery. Do you have a previous surgery?
Yes, but that is not the case. She has no surgeries. She's a diabetic patient. Okay, let's compare the answers. Let's see. The case report. Diabetic hypertension to kidney failure. Okay, but we need more details at this beginning, okay?
Okay.
The doctor. I don't know. I lost my. Okay, dear doctor, if you consider the physician, medical internal medicine, right?
Yeah.
That's perfect. So, dear doctor, I should be grateful to a woman diabetic. She describes your tachycardia palpitations. And what's more?
I was confused with the way to redact this in Spanish or.
Okay. Okay, that's okay. There's no problem. So we have this situation. The questions, for example, I written down a few of them. Why you came to the hospital today? What is going on with your body? Of course, just for getting an idea, that's complete the ones you were writing down, okay? How many days or months have your symptoms been going on? How many years you are diabetic? How about your diabetes treatment? Do you use insulin or pills? How about your diet? I'm sorry. More questions, go ahead following the findings. Of course, if you see the dry tongue, for example, with the dehydration situation, you can ask the patient how many days you are with that kind of tongue, how many days you are without taking enough water. Could be, are you thirsty? If you can make, if you can give up to punctuation to your thirstiness, how many, which number you could choose, for example. Do you feel pain? Where is the pain? And that kind of questions. So it depends on the findings. About the clinical evaluation, we have to look for the traditional complications in diabetes or the emergency complications. Well, as a general view, we have to look for signs of infection. Of course, we have just taking the vital signs, taking the possibility of a liver disease that is complicated the diabetes, and these other situations, functional, cognitive, or affective disorders, right, or disabilities that can make the patient leave the treatment and of course get in this kind of situation. And the traditional complications, coronary heart disease and heart failure, for example, edema in the lower limbs, we have to look for it. It's a very important situation. Signs of a stroke. peripheral vascular disease, or we might look for clubbing from, I don't know, what's the name of this? Peripheral cyanosis, peripheral neuropathy, the dumbness, right? The retinopathy, that's why we were talking about the fundoscopy, but we make this when the patient is not an emergency situation. So we have to get the patient in a better situation, and then with enough time and in a correct space, we have to make the evaluation of the retina and the diabetic kidney disease, of course. Just for information, I'm adding this picture. And we must look for the symptoms, the titration. In adults is the one we are talking about. The extreme thirst, urination less frequent, urine dark cloudy, fatigue, dizziness, confusion, headache. We have no details because the documentation, all the papers are not with us at this moment. But we don't know what the emergency room, what our colleague was looking for. So we have to consider that it could be mild to moderate or severe. If she was a severe case, she would be in confusion or without a correct mental status, okay? But if she's to the mild to moderate, now we can try to talk with her, and according to this, we can choose which one is the correct one. We have more clinical signs that we are looking for, and depending on these signs, we have to make the questions, right?
Right.
And we have the sepsis acronyms that I was showing in the presentation, right? Do you remember that?
Yeah.
I saw a similar picture, I write it down, and we have these ideas to consider. We didn't ask about pain. We have to look for if she's pale or discolored skin. We have to use if she's confused. Maybe she says she feels like dying because she's on bed. And of course, she has shortness of breath because her SpO2 is 89. I would make my case report in this way. You have to add the name, but just with the capital letters, okay? The name and the short name, the year, the age, years old woman, the sex, the pathologic antecedent, admitted today, because today she got into the hospital. She arrived at the A room where the doctor in ward decided to admit her for treatment. Just that, because we don't have more data from the emergency room.
Yeah.
Her findings at this moment are, and it depends on the findings we have. Diagnosis, uncompensated diabetes, septic shock, moderate to severe dehydration, and probable diabetic ketoacidosis. It depends on the labs we are going to take, of course.
Yeah.
We are not asking for at this moment for the labs, all the studies we need, because yesterday we watched the class. So we have to consider that, okay? The referral letter, of course, is going to be directed to a physician or endocrinologist. It depends on the situation, the one you choose, that's okay. Both of them can make the treatment. And legally, I think in every country, we need to consider one of them, okay? I will be grateful if you see this 65-year-old woman who has been admitted with fever, signs of moderate. We have to be sure which one is severe dehydration. At this moment, her vital signs are, and we add the Glasgow Coma scale. At this moment, I infer we have a 15-15 Glasgow Coma scale because we have no data if she's awakened or not. Her diagnoses are, and you explain all of them, and thanks a lot, and that's all. A very easy situation, right?
Yeah, right.
But it's easy to make, but it needs practice, and that's all. It's similar to the Spanish one, right?
Right. Can you make me a favor, please?
Yes, I'm going to send you this example, and you have here the homework for the next workshop. Yesterday we talked about labs and not invasive tests, invasive and not invasive. And tomorrow we are going to talk about the treatment, surgical, clinical, and other kinds of treatment. So you have to complete your answer to fill all the things we are checking at this moment. And then you can propose your lab studies and treatment. Why we are going to do this? Because with these results, we can complete the referral letter, because you have to say how you started attending your patient in the referral letter. It's not ready at this moment. You have half of the referral letter. You have to complete it. So finishing the workshop, I'm going to send the key and the rest of the situations, okay?
Okay.
Okay, can you please fill the pool? Can you watch this?
Yes.
Perfect. So tomorrow we talk about treatment, and then it's easier to make the homework. Today, by accident, I found an article that is talking about the clinical case you were preparing.
Could you send me
the
website?
Oh, no, I'm going to send the article too, because
Please.
I don't remember which one was the website. I'm going to do it with the both cases we are working on in order to do it. It's going to be so helpful. So, Belkin, that's all.
Bye-bye.
Go and start completing the findings. That's all. Okay?
Okay. Bye-bye.
Okay, bye, Belkin.
Bye-bye, Iris. Bye-bye, Ruth.
Bye. Hi, Ruth. Hi, my dear.
Bye.
How are you?
Hi. Fine, thank you. And you?
Fine, too. Here working hard. Yeah. Checking the homework with my students. From yesterday, maybe any question you have?
No.
Everything was okay?
Yes.
Perfect. So let me open your homework. And now let me check.
Well,
okay, tell me. I think I interrupted you.
No.
Okay, can you watch my screen?
Yes.
Perfect. So we have the case one. The guy with high BP, right?
Yes.
Okay. You receive a man, 50 years old, a security ward with headache that it's getting worse from 2 days ago, right? And it's without relief, taking painkillers. The questions you are preparing, the headache is always in morning. Okay, do you sleep well? Do you have nausea? That's a very important question. What kind of pills do you take? Very important question. Have you hypertension history in your family? Perfect question. Do you have cardiovascular disease? Good questions. Any other question you would like to ask for?
No, I think that can be helpful to to take more information and
okay,
made a good diagnosis.
Okay, according to the findings, you're going to ask more questions, right? Okay, so for a first moment, these questions are well done. I agree with them, that's okay. But maybe you can ask for many situations that the patient is not describing because he's with pain. Maybe about blurry vision, dizziness, you just hear about nausea, nobody asked about it at this moment, and that's okay. You can ask for edema, maybe the edema that comes and goes, could be. Maybe palpitations, he didn't say anything about it, but that's okay.
Okay.
Okay, with all the information you got from the anamnesis, okay, I'm sorry, write down the findings, the possible diagnosis. From these questions you make, you're asking for more details about the symptoms, right? And yes, you have as helpful data the vital signs. With this one's findings, headache with no relief, high BP, okay, and SpO2, okay. But the SpO2, yeah, could be at the sea level, 93. It's low. Yeah, the sea level is a little low. In the attitude, it's a normal one. We get worried when
Okay.
it's low, when it's under 85. With 93, we said he's okay, yeah, but that's okay. In the sea level, it's okay. A good finding.
Okay.
Okay. Okay. If we talk about the clinical examination, any other findings do you have from this situation? Maybe being creative, I mean, any other thing you would like to ask for to check?
No, well, for the diagnostic that I think the high pressure, the high BP is
Yeah.
the sign that we can think only in hypertension, and maybe if someone take a pressure before and the numbers was better than that today became,
Okay.
and maybe if a history family about hypertension, or maybe the cardiovascular disease,
Okay.
for better diagnostic, I think.
Okay, so don't worry. When we talk about findings, we must consider that when we have this value, 107, 110, we have to look for complications that maybe the patient is not describing because he is just concerning because of the pain. That's why our anamnesis is the most important part for getting more details and knowing what to look for. The vision loss can talk about as a lesion of the retina. We were talking about the fundoscopy and the findings in high BP. And as just an information situation, I mean. Moreover, the headache, he says that he is getting worse without, I'm sorry, without relief taking painkillers. It could be a signal of a stroke. We must ask about and look for data for strokes or something that could be worse if we don't evaluate the neurological sphere completely. Or maybe data from a heart failure and the patient didn't notice that he has chest pain added to the headache because the headache is worse. Or maybe data from a heart attack that is just starting, but the patient is concerned about the headache. It usually happens. And kidney disease or renal failure is just another kind of situation for evaluating, but it's important for us to take it, to consider it, right? We have a similar situation. We have more, just for having the idea about to ask for what to look for. We have this chart for considering the renal injury. The aortic dissection is a very painful situation. I don't consider it. The acute pulmonary edema, the acute heart failure, acute ischemic stroke, acute myocardial infarction. Also, I mean that we must look for more details, or maybe look for these situations. Altered mental status, maybe the patient is confusing data, maybe times, maybe he says 2 days ago, but someone of his family said, no, my relative was not like from this morning and he's lying you. So just be creative and try to complete. So we must ask for epistaxis. Maybe he had this situation days ago and now he doesn't remember the situation. Just being creative and getting the idea what is important to look for, we can complete the case. That's why I didn't give enough data, but not in the objective to check the medical knowledge. That's not the objective. The objective is to see how you use the medical terminology we were studying in the module 1.
Okay.
So I had a student who sent me all the signs that he could imagine, but in Spanish. And I said, what? Why in Spanish? He told me, please help me to translate. And I said, you have all the answers in the slides, please check them, bye, and that's all.
Yes.
That's
I got
very...
one mom's trying to understand the all the signs and symptoms.
Yes, but well, at least he tried. He tried to make an effort, and okay, I appreciate that, but check the slides. That's why I send it to you. Okay, about the case report, man or 54 year, well, always make it in past, not in present, okay?
Oh, okay, okay.
He has headache for 2 months because it was painful. Feels cognitive, okay. Retention, other things. Okay, at this moment, just taking the information box, that's okay. But here you have to add the vital signs. Let me show you how I propose one.
Okay.
Always
Oh.
try to add the capital letters of the name. That's not important to fill the complete name.
Okay.
Okay, the age, 50 years old, always the occupation. It's important for getting the laboral risks. And now in past, came to the consulting room complaining of intense headache. He has been feeling headache before 2 months while increasing the coffee consumption. At this moment, he said this pain was the worst ever. We can add this phrase that is in parentheses just for giving information, because that's what the patient is telling to us. But it's not an objective in the case report to express the ideas that the patient is telling us, okay?
Okay.
The vital signs report, you have to use them, and we can infer that he's with a Glasgow Coma Scale 15/15. It was his awake, he's talking to us. We sent our diagnosis, and that's all, okay? We are adding the diagnosis in order to start organizing our clinical history. But it's not a purpose to make it at this moment. We have to organize too. Well, about the referral letter, you didn't send one. That's okay.
No.
No, there is no problem, but just for having the example, the referral letter, of course, is going to be directed to a specialist. Which ones you would like to ask for help with this patient?
IMP?
I'm sorry?
A physician medical?
Okay, perfect. Anyone else maybe?
Cardiology?
Perfect. Anyone maybe?
And if we take a TCA, one MRI, maybe a neurology.
Okay. Could be, but maybe we don't have enough resources to make them, but we have neurological findings, we have to ask for help, okay? But that's okay. These ones are perfect for me. I would be grateful if you would see this 50-year-old man who has intense headache. He described the pain was the worst he's been suffering from yesterday morning without receiving relief while taking analgesics. At this moment, the moment of the evaluation, his vital signs are, and we describe them. His diagnosis, he's the hypertensive crisis at this moment, and thanks a lot. We don't have more data about the situation. And that's the way, for example, I've been, when I was in medical school, that was the way I was receiving my test. So write down all you want about this patient and give me your treatment. He said, what? You have 1 hour and a half to do that, go ahead. And we said, okay, so let's be creative. Sometimes you didn't have enough time to write as much as you wanted.
Yes.
In order, you just taken the data, and we must try to complete, okay? I'm going to send you these charts I'm preparing, and I think I'm gonna complete them, because tomorrow we are going to talk about treatment. Medical treatment, surgical treatment, and other kind of treatments. And according to this presentation, the yesterday one and the tomorrow one, we have to, well, we can work the next workshop completing this case report, this clinical case, I mean. Hi, Ruth, can you listen to me? Okay, the imagine was frozen.
I can't pull the pool.
Okay, let me share it again.
You have a euro.
Okay, can you watch it now?
Yes.
Okay, perfect. So finishing the
I can
workshop.
send in the pool.
Okay, close yours and I'm going to
Fine.
send it again.
Okay.
Okay, now it's possible to send. Yes, no,
No.
no, what's happening?
No, so it came código error 1035,000, algo así, aceptar.
Okay, let me check what's happening
Maybe it's
here.
my interconnection.
Okay, try to do this at this moment, maybe. Okay.
Yes.
Is that okay now?
Yes, it's okay.
Okay, perfect. So I was telling you, Ruth, when finishing the workshop, I'm going to send the
Okay.
directions of the homework, but it depends from the class on the class from yesterday and the tomorrow's class. Okay.
Okay.
Okay. So
Okay.
see you tomorrow, my dear.
Okay. Bye.
Bye.
Thank you. See you tomorrow.
Okay. Bye. Hi, Agar. Agar.
Hi, teacher. Good night.
Hi. Nice to meet you. How are you, my dear?
It was a good day, teacher.
Yes, everything's okay.
Yes, everything's okay. And you, teacher?
Well, everything's okay. At least today. Yeah. At least today. Yeah. Well, I know. No. This one. Okay, I'm opening the homework from the class of yesterday. Any question you have, maybe? Something you would like to check, a detail, or something that was not clear?
Not really. I have no question for the class of yesterday. I would like to see my homework
Yes, let's talk
because
about it.
I don't know if it's okay.
Okay, perfect. So, okay, report.
It's down. It's the
Okay, can you watch my screen? Is your homework, right?
yes. I can
Okay.
see it.
Okay, homework.
That-
Consultant with the patient, Bernardo. Okay, amnesis. Let's see the questions. That's perfect. Does your head hurt all the time? Perfect. Do you take any drug to relieve your pain? If you take it, what drug was? Okay, he told us that he was taking painkillers, analgesics. But that's okay, your question. If you take what drugs was, that's okay.
Okay.
Can you point to where it hurts? Perfect. I have just 2 students who were asking for this specific situation. Hi, John Harold. Give me a second, Agar.
Okay.
John Harold, yesterday we sent a corrected schedule, please. I'm sorry. Thank you. He's the next. There's no problem. Okay, how many cups of coffee? Oh, do you have any other symptom? Perfect. Nobody asked about it. No one had this important question. How many cups did coffee drink per day? Perfect. Have you ever been diagnosed with systemic hypertension or another pathology? Could be. Do you have a family? Isn't okay. Do you smoke? Okay. That's a good kind of questions. That's okay. According to me, that's okay. There's no problem, okay?
Okay.
After the anamnesis, you have the vital signs, write down the findings and the possible diagnosis. Okay, when I was asking about the findings, I was asking about this specific situation, the findings you could have in this patient using the medical terminology we were using for, right? We were studying the model 1. That's okay. There's no problem writing down this situation. That's okay for me. Possible diagnosis, uncontrolled systemic arterial hypertension to discard, could be. And let's make the case report. A 52-year-old man with a security guard had been headache, had been, you need here the verb.
Have you
Had been
have you
feeling?
feeling?
Been feeling headache since he started to drink more coffee and work at night for 2 months now. His pain had been worse since yesterday morning and doesn't relieve after taking painkillers. Okay, here you are expressing the patient ideas, and that's not objective in the case report. You have to use medical terminology for informing your colleague that there is a situation. Okay. Taking the vital signs, the patient reports hyperventilation. Well, 93%, it's a normal value in the attitude, we know. But there is no hyperventilation because we don't have that about the kind of breath or how he's breathing, right? Or he has symptoms of anxiety, maybe. Diagnosis.
Okay.
But that's okay, could be. I would try to discard this term because we are not talking about, he's not like this.
No,
We didn't give this information. When we receive patients with this kind of hypertensive situation, the hypertensive crisis and pain, he tries to be relaxed for controlling the pain. If he starts breathing, I don't know, like I was showing you with in a hyperventilation way, he's going to feel more pain, right? So that's not, I would try to discard this.
Okay.
I consider that we have to keep him quiet, we have to take again the vital signs. When it does not decrease, we must give a rapid oral agent. Okay, could be. But you are in a consulting room. You are in the primary care, could be, or in private space. Just for having the correct idea. If you have this value, you would take the patient with you in that place? Or would you consider to refer the patient or maybe to start treatment?
If I have the medication to act in this situation, I could treat the case.
Okay, that's okay.
Because in base, I was looking for the treatment of this case, and it refers to first that keep calm the patient for 20 and 30 minutes, and then we have to administer some medication, but no direct administrative medication, because it's not a crisis hypertensive. It's almost a crisis hypertensive, but it's not.
The crisis,
it has to be 180 to 120.
Okay, the limits of hypertensive crisis are discussing all the time. Just for taking the data, it's not to be closer in the boxed idea that the data is the topic one that we are going to solve. We have patients with this value that are dying with pain, and we must consider it as a crisis because the basal BP could be 90 and 60. So we have to consider the patient as the patient, not the chart, not the monitor. Treat the patient, right? That's the idea for considering these values. And we have not too much information. You were asking about more symptoms like blurry vision, tinnitus, edema in the lower limbs. Of course, we are going to find about how he feels, how he watches, and we are going to look for signs, right?
Yes, if the information could be with those signs, maybe I could select to give oral medication and transfer to a hospital.
Refer the patient.
refer to the patient.
Okay, that's a good idea. But depending on the findings, you can make the correct evaluation, right?
Yes.
Now we don't have information because he says, Dr. Agar, I'm with the worst pain. Please help me. My head is almost exploding. And you have to say, okay, let's find the solution, relax, and give me the information and organize ideas. The objective of this homework was not evaluating the medical knowledge, of course. That's not the objective. It's checking how creative you are about asking questions. With the ones we were studying in the module 1, according to the symptoms you could find, depending on the complication you want to give to your patient. You are free for doing this homework. When I was a medical student, that kind of cases were my evaluations, finishing my courses, I mean, my semesters. And they were like how can I say that? Like a cascada. You have the case, a very short one, like the one I sent you. And the next question is, according to your diagnosis, write down, and you have to ask one. And if you fail the diagnosis, of course, you fail all the tests. And that was an awful situation. So you have to think, you have to open your mind and try to look for. Okay?
Okay.
But that's okay. The possible questions, go ahead according to your symptoms. We didn't ask about palpitations. Okay? Tachycardia. That is described into the vital signs. It's not a very high value, but maybe the patient is with anxiety too, it's with pain. If he's with pain, he's going to have this value. It's not an important data at this moment.
Yes.
The respiratory rate is not important data. Maybe at this moment, the BP is going down. It is decreasing because he is 2 days with pain. But if he's feeling this pain 2 days, we must consider that it's not a non-controlled case. It could be a crisis because he's with pain. Maybe he might have most complications. And we have to ask the Glasgow Coma scale, it's 15/15 because he's awake. He's talking to us. He's moving by himself. And we must look for signs of this kind of complications. Signs of a stroke, the vision loss, the heart failure, heart attack. We must ask for sexual dysfunction or maybe kidney disease or renal failure. That could be happening, but we are not asking for about it. That's the same. So this picture is just for helping us to get the diagnosis and get the possible spheres that we have to look for more information and some symptoms, okay? Overload, hypoxia, angina, chest pain. Maybe he's with chest pain and he didn't say anything because he considers the headache is worst. It could happen. I had many patients with that, elderly people especially. My chest is because I'm bent, don't worry. And we make the ECG, we see an infarction and we said, okay, dear, you have to stay for many reasons, but this is one of the most important. Say, what? My heart is what? That's why you have to try to look for all the things you are trying to look for, okay?
Okay.
The case report always includes the name with a capital letter just. There's no important to write the full name, just the capital letters is enough. The age, the occupation, that's okay until this, and always starting past. Came to the consulting room, you say when was the first moment you evaluate the patient, complain of intense headache. He has been feeling headache for more than 2 months while increasing the coffee consumption. And it's not an objective to express how the patient is saying an idea, how the way he explains a symptom. But we say that the pain was the worst ever, but that's the expression he used. We have the vital signs and the diagnosis, and that's okay. If we make a referral, we have to start always with the dear doctor. And just for information, we can call the physician, the cardiologist, or if we look for and consider necessary the neurologist, if we have some findings. And that's the expression. I will be grateful if you see this, the age, the sex, and then you express the principal, the cardinal symptom. He described the pain as the word, blah, 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 blah. We have all the situation to express in the first paragraph. Then we go to the clinical findings. We only have the vital signs. At this moment, his vital signs are, tarara, all the data, considering the Glasgow Coma scale. His diagnosis is, and thanks a lot. Telling you, dear doctor, and saying thanks a lot, you almost win your colleague. And that's the data we must consider, okay?
Okay,
So
I didn't do that.
Yes, so while finishing the pool, I'm going to send the workshop, I'm going to send the homework according to these checking ideas we are completing, okay?
Okay.
So as I was telling you, there's not an objective to check the medical knowledge. We all are doctors, we are colleagues. And it's just being creative with the vocabulary and using it. Try to use as much as you can. I tell you by experience, if you talk in English, when you get the situation to have a patient in English, it will be easier to make the idea. You are not constructing the phrase at this moment. Your brain is going to have the memory, and then you can work on it. Okay, can you feel the pool?
I can see it.
Oh, okay, let me relaunch it again. It started raining. Maybe it's because of that.
Yes, that is not a good connection.
Yes.
Yesterday.
Yes, that was awful. Can you watch it?
No, not yet.
Okay. Let me try to send it again. And now John cannot get into. He's gonna come back.
He wanted to change yesterday.
He didn't tell me anything. I was asking for it. If he would tell me, we could change.
Okay.
Okay, I relaunch it. Can you watch it?
No, I can't. There is no.
Let me get it open. Okay, let me correct it, or please I'm going to send you a message as soon as, during the workshop, because I'm going to stay here until 10:30, I think. And okay, now can you watch it? I relaunch it again.
Oh, no, I can't.
Okay,
maybe I can wait, or I can get it again when you send me a message.
Okay. Well, I have a student that it's not coming. Just send me a message. At 10 p.m. in 1 hour. Can you enter again at 10 p.m. for trying to feel it? Okay. So let's try to do it at 10 p.m.
10 p.m.
Then we have time. The student is not coming, okay?
Okay,
bye,
thank
see you later. Bye-bye. Hi, John Harold. Can you listen to me, John Harold? You are muted.
Okay, yeah.
Perfect. How are you? You are on shift?
Yeah, I was just coming back.
Okay, perfect. So from yesterday, do you have any question maybe?
No, not actually. Yeah, it was clear. Yeah.
I think it was okay, right?
Yeah. I think, as always, there is a lot of vocabulary, but that's the only thing I think, the only part that we need to review, right?
Yeah, you have to check it. Okay, can you see my screen? Let's check the homework. Can you watch it?
Yes.
Okay, let's open yours. Question 7. Let's go to the situation. It's a very common situation in our country, I tell you by experience. You're the GP on shift in ward. There is a diabetic impatient with the next vital signs. Blah, blah, blah. With fever, with taking these vital signs, we consider a shock, right? You call the patient's nurse, and she says that she came from the AE room without papers. Then you make the secondary anamnesis, and so the patient is new for you. You are in your ward round, and you find this woman on bed in a bad situation. Write down all the questions you consider necessary. How long you have been feeling unwell? Perfect. Do you take any medication? Good. Have you had nausea or vomiting? Perfect. Nobody did this question until this time. Have you experienced dizziness, fatigue recently in the past few days? Okay. Have it normally last few days? Perfect. Any other questions maybe you have? Or that's all for you?
I think that was all. Yeah.
Okay, they are enough for this moment. That's okay. With all the information, write down all the findings and the possible diagnosis. The findings from the case are not enough. We just have the vital signs, okay? General data for considering many situations and many findings that we can describe. But we have an important situation. She's diabetic. If we have a diabetic patient with these vital signs, you are okay with your diagnosis, but which findings you can describe? Of course, we are not evaluating the medical knowledge. We're evaluating the vocabulary you can use in this situation, describing a critical patient.
Oh, I thought that we were supposed like to not invent a finding, to not suppose a finding, you know?
Yes, so, I was telling you when I send the homework, be creative. Invent all the information you want.
Oh, I misunderstand that, because I thought that it was like we only had the history of the patient and we only had that, right? So we were not supposed to ask the question and answer the question by ourselves, right? By making up a result of a laboratory test, right?
No, the lab test you are going to show me tomorrow, tomorrow next workshop. I'm going to explain it in a moment, please. So you have taken just these vital signs. You have a patient in shock, right?
Yes.
And considering she's diabetic and she's with fever and she's with tachycardia, we have a septic shock, not just sepsis. Okay. What's the most common sepsis situation or infection in diabetic woman?
Like
go ahead.
Like an UTI?
Yeah, could be. Urinary tract infection. Could be. That's the most common one. Having this diagnosis, you can construct all the findings, but all the findings are directed, to a diabetic patient with a urinary infection, right? With all the findings, the possible diagnosis, okay. Make the case report and the other diagnosis at the end. The case report is to all diabetic female, presented the GP of fatigue, lightheadedness, and chills past couple of days. Okay, could be vital signs. Okay.
I repeat the vital signs because I thought that we were not supposed to make up some results.
No, that's okay. You have this data, so you can use again. And you didn't consider enough to send a referral asking for a specialist to come to evaluate the patient?
Well, I didn't think so, because I thought like if she was in an emergency position, like you were like an inpatient with this type of vital signs and this type of like sepsis or septic shock. So I thought that we as a doctor were supposed to taking care of that, right? So
Okay, we
I
are
don't
going to
think
start.
I was supposed to refer to someone else, right?
Perfect, that's okay. So let's go. I propose you another kind of questions. Why you came into the hospital today? Because we don't have the correct reason. What is going on with your body? How many days or months have your symptoms been going on? How many years you are diabetic? How about your diabetes treatment? Do you use insulin or pills? How about the diet? And more questions, go ahead following the findings. Of course, it depends on the real situation we are creating with this patient, okay?
Claro, yes.
It depends on what we do. And talking about findings, we have to consider, just for information and getting and organizing the symptoms we were studying, we have to consider the diabetic kidney disease, retinopathy, peripheral neuropathy, yes, coronary heart disease. About all of these situations, we can create the complications we are treating in this patient, okay? And of course, a diabetic patient with these symptoms is going to be dehydrated. Yes. So we have to consider the symptoms in adults: extreme tears, urination less frequent, urine dark colored, fatigue, dizziness, confusion, and headache, right? So taking these symptoms, yes, we can start completing the homework and creating the case, I mean. It's just asking for the use of the vocabulary we were studying, not taking into account the medical knowledge. Of course, we are colleagues, and it's not an objective to evaluate the medical criteria you use. It's your choice, the way you work with her, but it's my job to check the vocabulary you use, okay? No. Okay. Talking about the rotation, more signs about mild to moderate or severe, you choose which ones you are going to use in this patient. And we have more clinical symptoms, okay? Symptoms and signs to check and to control. And we have the sepsis, the acronyms, the most important symptoms to check as an acronyms in general, but you can complete them in the way you consider it's necessary to do, okay? About the case report, the way I do this is this one. The name just with capital letters, not writing down the full name. The age, 62 years old woman. The clinical antecedent, the diabetic patient, admitted today because we are into the hospital. I must say when she was admitted into the hospital for treatment. But if she is not in the hospital, we finish here at this moment, okay? Diabetic patient, and that's the previous data we have to show that the one we are reporting the case. She arrived, always in past, at the A room, where the doctor in ward decided to admit her for treatment. We are supporting that our colleague had a criteria to admit the patient because something was wrong. We cannot add more data here because we don't have the answer from that colleague, what situation he's describing. So it is better, for example, if we had the report of the emergency room admitted for treatment because the diabetic patient is with an uncompensated case of diabetes and she has that of septic shock and he started this treatment. During my ward round, I reevaluated the patient and I got this other information, for example, and she describes this other, and she describes, and you described all the symptoms. My findings are, you describe the findings. So at this moment, my diagnoses are, and you make a list of the diagnosis.
Oh, okay.
And I propose the uncompensated diabetes, the septic shock, moderate severe dehydration, and probably diabetic ketoacidosis. We don't have lab tests for supporting all of these situations. And here in Bolivia, at least, we have to complete our evaluation with an specialist evaluation. Could be a physician, could be an endocrinologist. It's the same. You start the treatment, but for a legally way of working, you have to complete your evaluation with a specialist's opinion. At least you don't have the possibility to contact one. Okay, that's a legal situation we consider in Bolivia, and we have this one. Let me send it to you, please, for checking. And in that order, I'm going to explain you the homework.
Okay.
Tomorrow we are going to talk about the treatment. So we are going to work on write down to complete the findings, as I was telling you at this moment. And then from the class of yesterday, we have to complete the lab test you would ask for with results, the results you want to use. And tomorrow we are going to talk about treatment. So you are going to propose your treatment. That's in order to practice the way of expression, okay? So at the end of the workshop, I'm going to send all the homework. Can you see the pool? Can you watch the pool? I sent it.
Not right now.
No, at this moment, okay. Let me relaunch it once. Okay, can you watch it?
Actually, no. It doesn't appear to me.
Okay, Johan. The same trouble I had with Agar. Maybe you can come back at 10 p.m. because there is a student that is not coming to the class. And at that moment, I think the situation might be solved. Is that okay? You can come back in half an hour, in 30 minutes?
I think I can. Yes, I think I can. Yes.
Yes, please. I'm going to send a message by WhatsApp to remembering, okay? To remind you.
Okay, teacher.
Okay, so see you later.
See you.
See you, bye-bye. Hi, Catherine. I'm sorry, I take 3 minutes from yours.
No problem. Hi, teacher.
Hi, I think you were listening the homework I'm gonna send.
Last question about is you consider to refer the patient?
Okay. Well, let's open your homework and then we are going to check. From yesterday, maybe a question you have? Or everything was okay? It was a clear exposition, a clear presentation, I mean. So just the more important topics because there's a lot of information and it's not an easy fact to prepare it. Okay, can you watch my screen?
Yeah.
Okay.
Yes, teacher.
Okay, here you are with your questions. Okay, we have the high BP.
Yeah. Question how do I do the reference history?
Okay, the reference.
For example, in cause cardiology.
Perfect. I'm going to arrive to this point. I'm going to send you the example of a referral in this case. So let's start checking the questions you might ask with the situation. Male, yeah, 52 years old, security guard. That is with headache, and that's all without relief taking painkillers. We have the vital signs and we have the homework. Write down all the questions you consider necessary to get the probable diagnosis. Okay. How long have you been feeling unwell? Perfect. How much coffee do you drink per day? Perfect. Good question. Okay, have you experienced something like this before? Perfect. Nobody made this question, and it's a very important one. What kind of painkillers do you take? Perfect. Have you had nausea or vomiting? Perfect. Is this any history in your family about high BP? Perfect. Have you been eating normally? Perfect. That are very good questions. That they are okay for me. That's okay. When I decided to send a case like that, of course, there's not the idea to check the medical criteria, the medical knowledge. That's not the objective. The objective is to see how you use the medical terminology we were studying in the first module, right? So when I ask you about the findings, I'm asking for the situations you would find in a patient. For example, I'm not giving you all of the data because you have to look for and be creative on the situation you are prepared to evaluate. I don't know if there is a clear idea I'm showing you. Which findings you would add to this situation? Or maybe another question in order to get the findings.
A complementary exam.
Yes, we are going to go to that point. Okay, about the possible questions, of course, they go in order to the findings we get. We didn't ask about blurry vision, if the patient has a loss of vision. We are not asking for tinnitus, that sounds we hear while the high BP. We have to look for edema. This is an important sign because of the complications of the high BP. We know that he's with a tachycardia 105, but maybe he's with palpitations, or he says, yes, just at this moment I check that I have palpitations, he could say. So we have to consider this situation, that it depends on us which findings we are looking for and how is going to be the situation with this patient. And of course, we must consider the Glasgow Coma scale. He's awake. In order he's awake, we have a 15/15 points, right? So that's the way we can work on this. And it's important for us to remember that if he's talking, everything's okay. There is no way of getting worried. The way I'm looking for findings is the way you are creative in describing the signs you are taking in account with this kind of patient. For example, a headache could be a cardinal symptom of a stroke, right? But how do you evaluate a stroke, and which findings are related to this critical situation at this moment? Maybe there is a tightness, dampness, maybe it's he's losing the strength, he cannot move up his arms, or maybe he's without level. We have to consider all of this evaluation we were studying when we were checking the nervous system, right? With the vision loss, we were talking about the fundoscopy. We were checking the retina and have more signs to evaluate. And I sent you the picture with the findings in the high BP situation, the chronic and the acute one. But that's just for having the idea that the vocabulary is too wide and we have to play with this. Or maybe signs about acute heart failure, because high BP can reveal as a heart failure that was dismissed. Maybe a heart attack that the patient is not taking in account. Maybe a kidney disease or a renal failure that the patient didn't notice. Maybe a sexual dysfunction that the patient didn't take as a consequence. That's the same picture. I put it twice. And we have this chart showing us all the possible situations we are taking and suggesting treatment depending on the situation. But it's for tomorrow. It's just for information for doing homework.
Perhaps the mesh do the organisms?
Yes. For example, if you have an acute ischemic stroke, you can use nicardipine or labetalol. Here in Bolivia, we have labetalol, and it's hard to get it. It's not a common medication. Instead of nicardipine, we use another kind of pills that are similar, but not the perfect one. Acute heart failure, we use nitroglycerin or nitroprusside. The nitroprusside, it's not easy to get. Just use nitroglycerin if you get it. So we have another protocol for working on. But that's another objective. We have here more symptoms and signs to look for, to consider, and of course to try to construct the chart. That's a free job. That's why I didn't send enough data about it, okay? Okay, let's go to the case report. Male, 52 years old patient, BR and GP complaining of headaches that keeps getting worse for a few days. Perfect. The patient presented BP. Okay. Here, that's okay. You can add the diagnosis, but that's okay if you don't do that at this moment. It always goes to the last part. I propose you this one. The case report. When you prepare this paper, you can use capital letters. That's not important to send the full name written down. Just the capital letters, that's all. The age and the occupation, okay? If there is any pathological antecedent, for example, diabetes, or he knows that he has an hypertension, you can add it. Security ward, diabetic patient, for example. But if there is no clinical antecedent, just this data, that's the general data we are looking for. Name with capital letters, age, the sex, I erased it, and the occupation, okay? Always in past, came to the consulting room complaining of intense headache. He has been feeling headache before 2 months while increasing the coffee consumption. And we can add as an extra data the expression about the kind of pain we are talking at this moment. At this moment, he said this pain was the worst ever. But actually, that's not an important data because it's not an objective in the case report to express the patient ideas. It's just to give to a colleague the medical terminology information, just the pointed information about the situation he's going to evaluate. Because we are reporting the case to a superior one, to another doctor, the one who's receiving the word, it depends.
Is between parentheses?
Yeah, in parentheses is just an extra data we can write down if we really consider it's necessary.
Okay.
But it's not an objective to use this kind of expressions. It's not, actually it's not correct. But if we don't have enough data and we consider that they can use the data that it's the worst pain, the worst situation, the patient feels so bad, maybe we can add it. That's why it's in parentheses, because it depends on the situation, on the one you are reporting the case.
Okay.
The vital signs, of course, you have to write down them. And as we were talking, we have to add the Glasgow Coma scale. And in the final part, the diagnosis, okay? For me, it's a hypertensive crisis. And the referral letter,
Okay.
I suggest you to use this. Dear doctor is the best option to write down. Dear doctor, and you add the name or the last name, that's okay. And of course, you know the specialty. He's a specialist in internal medicine. He's a cardiologist, he's a neurologist, you know it. But that's okay if you only write down dear doctor. There is no problem if you don't know the name. That's a very polite way of expression when you want to send a patient or when you want to ask for a doctor to come to evaluate this patient. The expression, I would be grateful if you would see this, el man or patient who has intense headache. He described this pain was the worst he'd been suffering from yesterday morning without receiving relief. Just the case report, but in a brief line. More brief than the case report, okay? More going just to the topic idea. At this moment, his vital signs, his findings, his symptoms and signs are, and you describe with medical terminology all the things you get. And then his diagnosis is hypertensive crisis. You finish with the polite thanks a lot, and that's all.
Okay.
I'm going to send you this as an example, okay?
Okay. A reference is short, not only
Going to
the
the point.
study.
Yes, it's very short situation, very short explanation of the case. Going to the point, and that's all.
Okay.
Okay, can you see the diary pool? Can you watch this? Because we are having trouble filling the pool.
There is a problem, teacher. No.
It doesn't let you. Okay, let me share it again. Okay, now is that okay?
Okay, it's okay, teacher.
Perfect. Okay, thank you so much, Catherine. So the homework now I'm asking for is oriented in this way, is directed, I mean. Yesterday we were watching the lab tests and studies, invasive and not invasive ones, right?
Okay.
Okay. Tomorrow we are going to talk about treatment, medical treatment, surgical treatment, and any and other kind of treatments, and a general view of all of them. In that way, the homework is to complete this clinical situation, being creative. You can choose all the findings, all the signs, all the symptoms you can use to your patient. Use as much as you can, first of all. Then write down the lab test with results according to the situation you are treating. You do it by your own. For example, it's a hypertensive crisis, right? But when you take the lab test, you have to consider many situations like the creatinine, for example, if it's increased, if it's low, and then according to the value, you know if there is a complication, right? So in that way, you can ask for as much as lab test as you want with the results. And then if you want an electrocardiogram, you can ask for it. If you want X-rays, you can ask for it. Depending on the results, you purpose your treatment. Of course, we are going to talk about treatment tomorrow. So tomorrow you are going to have the idea about the treatment you want to start with this patient.
Okay.
Okay.
Arthritis, teacher?
No. The treatment about the high BP we are talking at this moment.
Oh, okay. Yeah. Teacher.
Okay. For example, I was asking for a referral letter because here in Bolivia, as a general practitioners, we cannot treat this kind of situations alone. It's what our law says. We need the opinion of a specialist, right? Just take an opinion. The referral letter has two objectives: have the evaluation of the specialists and taking the good view, or maybe asking for the specialist to complete the treatment. That's all. So making this homework, we are going to complete the case report and complete the referral with me. We are going to complete those papers in order to have the full paper done. And it's easier to make it.
Okay, teacher.
Okay, so in that way, I'm going to send the topics of the homework, and that's all. I think. Don't worry, it's gonna be easy. Okay, so my dear Catherine, see you tomorrow.
See you, teacher.
Okay, bye. Hi, Mario. Mario.
Sorry. Hi.
Hi, how are you? It's nice to see you again. What's
Yeah,
going on? I'm
well, I
worried
had some
about you.
problems.
No, don't
No,
worry.
no.
I'm worried about you because you are missing 3 classes at this moment. And there's a lot of information.
Yeah, thank you. The thing is that one of the residents got sick in the hospital,
Okay.
so I have to cover his turn now. Yeah, see his shift.
Okay.
Yeah.
It's okay, please. I'm going to try to complete the chart from yesterday, telling that you were on shift because of the assistance. We take it in count because of the scores. So
Okay, thank you.
okay, let's have patience. Let's cross fingers for asking for them. I sent the presentation from yesterday. Did you have enough time to check it?
Yeah, I was checking it.
Okay, and any question? I think it was very clear, but maybe something gets
Yeah, it was very clear.
Okay, perfect. Moreover, I sent you homework in WhatsApp.
Yeah, I saw it, but I wasn't able to finish
Okay,
it.
you were without time for doing it. Hello, it's frozen.
Sorry?
No, my screen was frozen. I'm sorry.
Okay.
I'm asking you about the homework. Did you prepare it? Do you have a
Yeah.
paper done about it?
I was doing it, but I wasn't able to finish it. So I think I will able to send it tomorrow. I think.
Okay, if you want, we can check until this point. At this moment, I'm not evaluating this situation. I'm checking what you are doing at this moment, and I'm correcting in order to have the idea what you have to do.
Yeah, the thing is that I have only my phone right now, so I don't have my computer.
Okay, so let me close it. I'm going to open the case in my computer.
Okay.
And let's check this. Give me a second, please. Let me share the screen. Okay, can you watch my screen now?
Yes.
Okay, I send you the third one because we are on shift and you are watching this kind of patients. I mean, is that okay? Or maybe I'm in mistake for changing it at this moment?
It's okay. It's okay.
Okay. You are the GP on shift, it's your position. And there is a patient with the next vital signs. We have the general data. She has an identification. That's the best. Here in Bolivia, it's not a very common situation to find identifications. BP 8 and 60, pulse 112, respiratory rate 26, temperature 39.2, and SpO2 84%. That's a wrong situation.
Yeah.
According to your knowledge, of course, I'm not evaluating the medical knowledge. I'm evaluating the way you use the medical terminology we were studying in the module 1. You have to write down all the symptoms, all the questions you could ask for this patient, considering this situation. The nurse told you that she arrived to the A room without relatives. She's alone. She came in a taxi. She left her and say goodbye. Have a good luck.
Yeah, it happens.
At this moment, you don't have more information. The first time you see her, you must ask all the things you consider necessary. Be creative. Don't close mind and make as many questions you have in mind. There's no problem if you make 51.
Okay.
Choose them, get them in order to complete this situation. Do you have any question at this moment? Questions you might ask about it, maybe?
Well, I might ask, where is she from?
Okay.
How well, how old is she? She's 59. She which symptoms did she has?
Okay,
Does she have
considering
present?
these situations, which symptoms you are looking for?
Well, I'm looking like respiratory symptoms, like
Yeah,
cough, short of breath, like the dyspnea,
dyspnea.
dyspnea, um, sneezing and hemoptysis.
Perfect. So
Uh,
try to write down as much questions as you have, okay?
okay.
But consider she's a critical patient. Look at this saturation. In attitude, in the place I live, 84, it's not as bad as we think.
Well, okay.
It's for taking attention, for starting the oxygen supplements, but in the sea level, it's a value for getting intubated.
Yeah.
So let me correct it, because you're not going to bait your patient. We're going to use this device. So just for, I'm just realized that. So with 89, it's a critical situation with your patient, but it's easy to correct it. Okay.
Yeah, it's not difficult.
Yeah.
Okay.
Write down all the findings and the possible diagnosis. All the findings as a list in the way you want. Be creative. Use as much as you can. And you are now the chief. You can direct the case in the way you want.
Okay.
If you consider it's pneumonia, you can write down the signs of pneumonia. I don't know, pyelonephritis, you can write down the pyelonephritis signs, or maybe you have another situation that are very complicated. I know that's your choice. I want to see the use of the vocabulary, okay? Again, I'm not evaluating the medical criteria. I'm evaluating the use of the vocabulary. Of course, when you are going to have a patient with these situations, well, you are not going to construct the idea just at the moment you see the patient. Making this exercise, you are going to have the idea on mind. And while having the experience, you are going to work faster. That's why I'm asking for an open job. Okay. So the possible diagnosis, you choose as much as you want. There is no problem for me. With all the information you got, make a case report. And of course, you add the diagnosis. For example, here I have a diabetic patient. The case report, you are writing down perfect, very good case reports. But this is the case report. And you just add the diagnosis. It's not apart from this at this moment, okay?
Okay.
You only have the idea for organizing the paper. If you consider to refer the patient, tell me which one could be the best for her and write down the referral letter. I sent an example about a referral letter in the 6th or 7th presentation. I don't know if you remember that. I'm not sure.
Yeah, I remember.
Okay, checking this, you can complete the referral depending on the situation you are preparing. And then we are going to check all of this. The homework I'm asking for your classmates to do is very easy. Yesterday we were checking lab tests and invasive and non-invasive evaluations, right?
Yeah.
Lots of things to do. Taking that presentation and tomorrow's presentation, tomorrow we are going to talk about treatment, medical treatment, surgical treatment, and then other kind of treatments. And taking into account these two presentations, you have to complete, to correct the homework you sent to me. And on Thursday, we are going to check the lab tests you propose and the results you share.
Okay.
We are going to evaluate, to check the treatment you propose. With this complete information, we can complete the case report and the referral letter. So it's important for me to check your case before the next workshop.
Okay.
It's possible to send it to me tomorrow as
Yeah,
soon as possible. Okay, try to finish it and send it to me because you have an open situation, very open, very common way to receive a patient, right?
Yes.
But consider this. This is the most important part. This and this.
Yes.
Well, maybe this one too. It depends on the situation. I prepared 3 cases, and yours is the easiest, I think, because you have a full ideas to write down and to direct the job. Okay.
Okay.
Any question you have about it?
No, I don't have any question.
Okay, I think it's clear. It's okay. So let's fill the pool. Yeah.
Okay.
Hi, Agar. I'm sending the pool.
Okay.
I don't know what's going on. I don't know what's going on with the connection, but it's failing. Can you watch the pool?
Yes, I can watch it, but it says okay. It's okay. Now I can see.
Okay, perfect. Agar, can you watch it?
No, I don't know why I can't see it.
Okay, don't worry, I'm going to correct it. Okay, Mario. So finishing with you, complete your homework, please, and send it to me as soon as possible, okay, to check. And then I'm going to send the direction of the homework while finishing the workshop, okay?
Perfect. Thank you.
Okay, see you, Mario. And please try to come for assistance. It's very important.
Have a nice night.
Okay, you too. Bye.
Bye.
Bye, John Harold. Can you watch the pool?
Yes, I already feel it.
Perfect. Thank you so much. So if you feel it, it's your assistance. Done. So see you tomorrow. Okay, Agar, let me relaunch it again.
Okay.
Okay,
Only
is that
me.
okay? Can you watch it? I relaunch it.
No, I can't, teacher. I don't know why.
Let's stay and try to correct it. We have 15 minutes to do it. Yeah.
Okay.
What happened? With Ruth, we were having the same situation.
What could be the problem?
The internet connection. She has disturbances, and almost all the time was freezing the screen. But maybe at this moment we can feel it. Okay, maybe at this time, can you watch it?
No. Nothing.
Okay. You are on your cell phone, maybe?
Yes.
Let me.
My laptop is very, very, very low. It's a very low connection because I connect. That's why I connect in the cell.
I'm going to make you a co-host. Maybe you can watch. Now you are a host with me. Yeah. Yes. Can you watch it?
No, I can see it.
Now you can do it?
No, I can do it, but I see it.
Okay. And make me a favor, please take a screen capture from your cell phone and send it to me.
Okay.
In order to have a data that you were in class in the workshop, and send it to the academic superior for not making you as an absence, okay? For not taking you more time, because it's not okay, it happens.
Okay, I'm gonna, yeah. I can feel it, but I took a screenshot.
Yes, please. Let me get into the video. Okay. Well, I have the diary pool. and doesn't let me feel it. Okay, I got your screenshot. Stop sharing. Okay, let me relaunch it again. Is that okay now? Can you feel it?
No, it's the same. It's the same. I can see it, but I can see it, but I can't feel it. I know.
That's strange.
Something is wrong with my connection because only me.
Yes, just you are having this trouble. Just you. Well, as I was telling you, with Ruth, we had the same problem. Let's do this. Let me send me a message to the chat.
Okay.
From the Zoom chat. It's going to be recorded to the superior. Okay.
Can you see it?
Yes. I received a hi. Yeah. Hi. Hello. Yeah. And then you can say the answers 1 and the number just.
Okay.
1, it pointed, I don't know, pointed 1. Yeah.
Okay.
And I'm going to tell the superior that was the trouble. We were having disturbances with the connection. It's out of our hands. Okay.
I finished.
Okay. I don't receive your message in the Zoom chat.
No.
No. Okay. Yes, I got it.
Okay.
Okay,
It's
I got it.
Slow. The connection.
Okay, perfect. I'm going to use it to talk to the academical superior for taking in account your assistance because it's out of our hands. And of course, I'm not going to torture you staying in the Zoom session.
Okay, teacher.
Okay, my dear. I think it's okay.
I hope tomorrow it makes a better connection.
Yes, we have the same. We have
I
to
think the
improve.
problem is the line, because I am Intel and Intel have problems.
I am Tigo, and with Tigo I have the same troubles.
Yes.
I want to change. Yes, I have Tigo to my cell phone and Intel to the Wi-Fi, and always Intel was better than Tigo. Not the best, but was better. Was supporting.
Maybe I can change. My Wi-Fi is Tigo. My cell phone is Intel, but now I am with Tigo.
Okay, try to change it. Maybe at this moment we can solve the situation.
Okay.
We have time. Yeah,
No,
we have 6 minutes more.
I change it now.
Okay, you made the change, but there's no answer. Let's relaunch it again.
Yes.
Okay, I send it again.
Now?
The same situation, right?
No.
Okay. Okay, don't worry. I'm going to send the picture of the chat and the screenshots you send me, and I think that's enough for solving your assistance. Don't worry. We're going to find the solution of this.
Okay.
So see you tomorrow. Relax. Complete the homework. You know, you have to complete the findings.
The findings, yes. I have to complete with, I consider to find in this case.
Yes, all the findings you want. It's an open homework. If you consider you have, I don't know, findings for a stroke, perfect, write down them. If you consider there are findings for a heart failure, that's okay, use them. If you want to combine situations, perfect, do this.
In order to guide my diagnosis or
yes, in order to support your diagnosis, you can complete all the findings you want.
Okay.
You have to support it, and that's all for me. And the next workshop, we are going to check the labs you are proposing and the treatment you are proposing to. It's a long homework, but it's important to get the idea of how to use the vocabulary. And that's a good idea with a practical situation because you do it context.
Yes. Teacher, can you set the examples that you?
Yes, I'm going to send it. No, I'm going to send it at the end of the workshop. I'm going to divide the file. That's why I'm not sending at this moment.
Okay, teacher, thank you.
I'm going to find to the WhatsApp, not to the group, to the WhatsApp, each one its own case for not getting in confusion.
Okay, teacher, thank you very much. So see you tomorrow.
See you, Agar. Have a nice night.
You too. Good night.
Good night. Bye-bye. Okay, at this moment, I almost finished. Maria Fernanda was supposed to come at this moment, but she sent me a message telling me that she's not with good connection. I'm not sure. Let me look for the message. Had you be able to get connected tonight to the workshop? Okay, she's not going to be able. Well, patience. And now I'm expecting Ariana. She's going to come in 2 minutes more. I hope she can do it. She was at the university, told me. So patience. Yeah. Oh yeah, okay. I'm asking for finishing homework I sent last week because I'm going to send the new points of homework and I'd like her working. She's a good student, but she's not working at this moment and it's scaring me. Good test, but not good assistance. Well, it's her choice. And I have no answer for Claudia. Micheline never comes. So let me ask her if she can get into. She's online. Maybe she can get at this moment. Yeah, she's connecting now. Let's wait for her. She's a great student. Let's wait for a minute. Hi. Yes. Hi, Ariana. How are you?
I'm good, thank you.
How was your class today?
It was a stressful class, and I had to fly back home, but I'm okay.
Okay, I'm sorry. At this moment, the student was supposed to be before you didn't come.
Oh no.
No, but that's okay. Don't worry. Just 15 minutes. That's okay. And as I was writing in the message, the first ones that are after you are not coming from the module one. So
Of
so
course.
that's not an objective. They are on list because they paid all the course, but they are
Yeah.
not coming. So
Oh, that's sad.
that's an awful situation. It's for them. I wouldn't miss a course like this if I was
Yeah.
paid.
Yes.
That's their choice. From yesterday, any question you have, maybe?
From yesterday, no, the class was pretty clear.
Yes, that's perfect. So let's check homework. I was opening the situation and okay. You were working with the guy with high BP, right?
Yes.
Okay. Receive a patient, Bernardo Rocha. I don't know why I like this name. I think it's easy to remember.
Yes, it was in my mind.
Okay, all the questions you consider necessary, okay? When did the pain start or the started? Okay. Where exactly does it hurt? Perfect, very good question. Where exactly does it hurt? Which part of the head? Does it hurt anywhere else? Perfect, nobody make this question.
Hey.
From 1 to 10, how much it hurts? The EVA scale, perfect. The pain evaluation, perfect. Is the pain the only thing that bothers? Very good question. Maybe another symptoms, no?
Yes.
Is there anything that might relieve the pain? Of course, no. When do you feel the worst? Perfect. Does it hurt more when you do something specific? Could be. How long does the pain last? Well, he says 2 days the worst. Do you have family history of this kind of pain? Good question. Do you drink alcohol? Do you smoke? Good. How is your diet? When did you last check your weight? Very good questions. Let's go to the case. So you have good questions at this moment, but we might complete being more specific situations, okay? For example, asking for dizziness, from blurry vision, tinnitus, I don't know, palpitations. Maybe we can look for edema in the low limbs, but that's okay.
Okay.
The findings, where it is. And the possibility he has tachycardia because he's also hypertensive. Okay, it's close to hypertensive crisis. Okay, you're in a closed box of an idea. It's low. Well, with the sea level, it's low. But actually, it's not a low sea level, not low SpO2.
Oh, okay.
The skin is thinner and edema on the limbs was noted. Perfect, you are adding the signs. Nobody made this. Nobody. All of your classmates just taking the vital signs and say, that's all. And I said, no, you had an open homework. You must be creative.
You need to use your imagination.
Yes. Everybody I told, use your imagination, be creative, add as much as you want. The way to, okay, his OB is perfect. During the fundoscopy, yes, you're the only one who described the fundoscopy. Nobody made this. Nothing with exudates and the swelling of the optic disc. Okay, when you talk about these findings, you are referring to a first or to a chronic high BP or a crisis?
Oh, I'm referring that he has that at the moment of but he hasn't been diagnosed before.
Okay, that's
But
the first time.
Yeah, but he probably had it for more time.
Perfect. That's the idea. You're getting the point. Make the case report, okay? A 50-year-old patient presents to the GP with cephalalgia, could be that started 2 months ago, but it's intensified yesterday. He refers he had taken painkillers. Okay, when we make a case report, we don't use the words of the patient.
Oh, okay.
We don't use in Spanish, we say it, he refers. But in English, we don't say that expression. We just say he took or he took painkillers, he took analgesics without relief. That's all.
Oh, okay.
I'm going to show you, give me a minute, please. His vital signs show that the high tachycardia. Okay, his vital signs where, and you got all the values. I'm going to show you the example, don't worry. Tachycardia because of his BP and he was close on the person. Okay, when we say he was close, we are referring to the classification, right?
Yes.
And when we talk about hypertensive crisis, we don't have to be in a closed idea that the patient has to reach an exactly value. It's going to show you the experience, that situation.
Oh,
For example, my normal BP is 90 and 60. If I get 120 and 90, for me, it's a crisis hypertensive because of the situation that's specific for me. That's why I was showing you the phrase, treat the patient, knows the monitor.
Oh, okay. So I should have put hypertensive stage 2. And that's it.
No, if he was a chronic case, a reported chronic, not a new case, it could be classified as a stage 2, stage 1, it doesn't matter.
Oh, yeah.
But it's the first time he's coming with this symptom, with these findings. So it's a crisis.
Okay.
You can support the crisis because of the pain and all the findings you are showing us. Maybe he was hypertensive patient and he didn't know about the diagnosis. But now at this moment, he's getting worse. We have to look for some signs, some symptoms, and then define the situation for him. And of course, start the treatment, right?
Oh, okay, I get it.
His fascia was depressive and he had thinner skin and edema. Okay, his fascia was depressive. He was showing thinner skin, edema in lower limbs. And he also was overweight, or his BMI was 3.5 and we infer that he's obese.
Okay.
The fundoscopy shows the fundoscopy reports, hemorrhagic exudates, all the medical terminology, you know. So she was not. After the rights test, okay, the tests are not at this moment an objective, okay? But the diagnosis is stage 2 hypertension, could be, but well, that's the first time we are working on this. Okay, to refer the patient, okay, the data. You send it to me, yeah. Thank you so much. That's okay, but we are talking about the specialists. Which specialist you will choose for sending the patient?
Cardiologist.
The cardiologist, another one maybe?
Internal medicine.
Perfect, the another one? Depending on the findings, right?
Oh, okay, yeah. Also the nutritionist.
Yeah, nutritionist, perfect. Which one?
Ophthalmologist too.
The ophthalmologist, because you have the heart exudates and the edema, right? Perfect.
Yeah.
You have to consider the situation, but I'm not at this moment. Okay, I would like to refer Mr. Bernardo Rocha to, okay. When you ask a referral, you are not asking for a checkup, you're asking for supporting your treatment and completing the evaluation maybe, but during this first moment, a referral letter is asking the specialist to come with you.
Oh, okay.
Yes, with Ramon and hypertension. Okay. Before, okay. We don't have to explain this point that we are not available with the equipment, the correct equipment. But that's okay.
I'm used to.
Yes, in our countries, it's a very common situation.
Yes.
in the United States and the USA, if you write down these lines, you are going to lose your job because you are showing that you are not an enough hospital for treating common cases.
Very good.
But that's okay. In general, your work is okay. I like it.
Thank you.
So I prepared the answers that I would use, okay? Can you watch my screen, right?
Yes.
We have the case. Of course, the questions are well done. There is no trouble. But sometimes with, well, he's a security ward. In that way, this patient maybe has not enough idea about the situation he's complaining, okay? So it's better if you direct the anamnesis and ask very pointed situations. For example, blurry vision, tinnitus, describe the edema, but you can ask for how many times with the edema, it is worse in the morning or in the afternoon. You can ask about palpitations. Now he's with tachycardia, but who knows if it's chronic or it's a new situation. So according to your findings, you can complete the situation, okay?
Yes, I put the edema and the tachycardia in the findings and not in the questions.
Yes, but that's okay. There's no problem. It depends on the situation. According to the findings, the questions are going to be done.
Okay.
Of course, you cannot sit down and ask for with a full list because the patient is with pain.
Yes.
You have to be so fast about asking and taking the physical examination. And during this evaluation, you are asking and asking and asking more, right?
Okay.
That's the way, for example, I work and it's easy to do.
Of course,
In
you have to work.
findings, nobody reported the Glasgow Coma scale. He's awake. He's talking to me. He's 15/15. That's all. But that's okay. With these findings, we can infer that now at this moment, maybe he is having or he is standing a stroke, but without critical complications, because it's a patient that we have to consider as a critical one because of this data. It's a situation that we must control as soon as possible according to the situation. We have to look for signs and symptoms of a stroke, vision loss that you were writing down, heart failure, acute or chronic, there is no problem. Maybe a heart attack that the patient is not considering, maybe a kidney disease or a renal failure. We have to look for information about it. That's why the questions goes according to the findings, okay?
Okay.
That's the same picture. And we have an idea about this first is better to ask for, okay? But just for having us an information situation, okay?
Yeah, that's fine.
And we have suggesting the correct medication, the correct treatment, but it's not an objective at this moment. More signs and symptoms to check and to look for, and that's all. For checking the situation and making our evaluation on our findings in order to check the use of the medical vocabulary we were practicing in the module 1, not for checking the medical knowledge. The objective is not to check the medical criteria or the medical knowledge, is to evaluate the use of the medical vocabulary we were gaining during the module 1.
Yes.
Okay, in that way, if you write down the questions, write down the symptoms, it's easier for you to do it when you get in a real situation, of course.
Yes.
Okay, you want to go to England, so you have to be so fast for constructing the ideas and ideas and ideas and practicing and checking and reporting this kind of situations.
Yes.
About the case report, the way I write down this is this, just the capital letter for the name.
Oh, okay.
The name and the last name. That's okay if you write down the full name or you just use the capital letters, there's no problem. The age, sex, and the occupation. Of course, the occupation is one of the most important parts because we can infer the laboral risk he has.
Okay.
Always talking in past. You are not talking in past. And we must correct it, okay?
No, it's on the, oh yeah.
Okay, presents to the GP, no, presented to the GP, okay? He that had started could be, try to talk always in past or in a passive way, but always in past. It doesn't matter the exactly way. If you talk in present, it's not a correct case report, okay?
Okay. Yes.
The consulting room complained of intense headache. He has been feeling headache or cephalgia, as you were writing down, before 2 months while increasing the coffee consumption. This phrase that is in parentheses, it's not a part of the case report indeed. It's not necessary to write down. But if you consider that your colleague is going to use this data, you can add it. But I don't recommend you to write down this kind of expression. At this moment, he said this pain was the worst ever. No, we are not reporting what the patient says. We report the symptoms he refers with the medical terminology, and we explain the findings we have, okay, with the medical terminology. About the findings, vital signs report, and we write down the last vital signs we have, adding always the Glasgow Coma scale. If we don't add it, we cannot say that the neurological sphere is okay. So we have to support our idea. And the diagnosis, hypertensive crisis for me at this moment, but the hypertensive crisis has to be supported according to the lab test and many other situations we are going to talk.
Yeah.
About the referral letter, we have expressions to consider. The dear doctor is the most polite way to ask for the specialist to evaluate and treat your patient. The physician, cardiologist, neurologist, that's okay. It doesn't matter if he's going to check the patient from a month, I don't know, or he's going to check the patient tomorrow at this moment. That's not the way. You have to be prepared to write down with this. Dear doctor, I would be grateful if you see this 50-year-old man with a real patient who has intense cephalgia or headache, that's okay. And now you can write down, he described the pain as the worst he's been suffering because it's an important data considering the neurological sphere. We can be in front of our subarachnoid hemorrhage. Nobody considered this situation. The worst headache that installs as a thumb light just comes and never goes until operating it. Okay, and nothing relieves this pain. I had experience of a patient with 40 years that had this situation after using his motorcycle. He came to my emergency room and he told me my headache is worse than this morning. I feel bad and I need to know what's happening. He has antecedent of migraine.
Oh.
And I said, okay, let's make the CT scan. Why not? We did it and we found the hemorrhage.
Oh,
and we said, okay, good luck, neurologist, please call the neurosurgeon. That's an urgency, a real urgency. So we have to consider this. If he say this expression as the worst pain he's suffering, consider all of the situations, okay? There are specific data I'm giving you for getting the full ideas, okay?
of course, thank you.
At this moment, his vital signs are, and you report the last ones you have with the Glasgow Coma scale. And you say his diagnosis, blah, blah. And the golden phrase, thanks a lot, always.
Okay.
That's a very brief example. And we have to add here the findings you are going to add to your homework, to your answer. And we have homework for Thursday from the next workshop. Yesterday, we were talking about invasive and non-invasive, right?
Yes.
And tomorrow, we are going to talk about treatment. According to the yesterday class and the tomorrow class, it's itching. You have to complete your homework, the lab results. Of course, you're going to ask for lab tests. You are going to show me the lab results you want. It's free. All of them can be normal, that's okay. All of them can be a pathological value, that's okay. And you send it to me until Sunday, I mean. It's a lot of homework.
Okay.
I'm going to write down the topics and we are going to work. Tomorrow we have the class of medical treatment, surgical treatment, and other treatments. And with that ideas, we can complete the situation. And on Thursday, we are going to check the general view of this.
Okay. I won't be attending tomorrow's class.
Okay.
So I'll have to watch the recording.
Okay. As I finish the class, it's going to be recorded on the Zoom and the YouTube. But of course, I'm going to send to the group the slides.
Okay, thank you very much.
So don't worry, it's gonna be so clear. It's not a very long exposition and it's not a complicated one. I know it's a difficult moment because we are without time, but let's try to do this, okay?
Okay.
If we don't finish, that's okay. If we finish, it's better, yeah.
Yeah.
So don't worry, it's gonna be okay.
Okay, thank you.
Okay, can you see the pool?
Yeah. Oh, but it's closed. I can't.
It's closed. Okay. Oh, I'm sorry. I made a mistake. Yeah.
Okay.
Okay. Relaunch. Now.
No, it's okay.
Yes. Yeah.
Okay, I finished.
Okay. So, any question, maybe?
No, it was clear. I have to correct
It was
the
clear.
homework.
Okay. Okay, so you have an open job, you can be creative. If you want, you can add more symptoms, you can add signs. If you, for example, in the non-invasive tests, you want to add an ECG, you can describe the findings, that's okay. Or you can just show the picture of the ECG, but you have to tell me the findings of this study.
Of course.
Not for evaluating the medical knowledge. Don't worry about it. Just for evaluating the use of the medical terminology. Okay. So for me, there is no problem if you tell me everything's normal. Okay, if everything's normal, you're going to ask me, you're going to answer me about these findings, and you're going to report me.
Okay. No,
So,
it's not gonna be normal. Don't worry.
Yes, you can do it. I told you, you're gonna be my bunny. You're in the 5th year, you can do it.
No, I'm glad. This class actually gives me peace.
Yes, it's easy. It's a piece of cake.
No, it's
Yes.
not easy.
Yes, you can do it. You are prepared. For England, you have to be more prepared, more than prepared.
I know. I'm reconsidering now.
No. Don't reconsider it. Don't change your mind. That's a great point. That's a good idea to go there. If you can go out of Latin America, go ahead. I tell you by experience. Certainly, when I was almost coming back to Bolivia, I was not sure if it was the best decision. But I came here in order to visit my parents and my siblings.
Of course.
And staying in Bolivia, I discovered I was pregnant and I couldn't go ahead again.
Oh my God.
Yes, and I said, okay, that's a signal. I have to stay in Bolivia. I need to stay here because a child is coming.
Yeah.
No, my child is 11. So I have a big boy, not a baby boy. He's a big boy.
Yeah, he's big.
And that's okay. But if you have the opportunity to go to England, go. You are going to see that the world is huge years of difference from Latin America.
Yeah, I can imagine.
Yes, I had a friend, an amazing physician that comes to Bolivia, works 3-4 months just for having fun and goes back to England again. Yes, but that's true. His real job is in England. He's a specialist in England, and his vacation, he comes to Bolivia to visit his family, and work a little bit and have fun with patients, not losing the contact with the colleagues.
No. I want to be in that part of my life.
Yes, you're going to do this. Which specialty you are choosing or you're thinking on at this moment? Maybe change.
I'm thinking I have options. I like gynecology and pediatrics,
Yeah,
but
could be.
they're kind of connected. So
Yeah, and they are so required. So required. They really need good obstetrics and good pediatrics.
oh,
So
I
you can
hope
do it. Don't be stressed at this moment. Just relax, get vocabulary, start reading in English as much as you can, and you can do it. You are going to complete.
Oh, yeah, thank you.
Take a deep breath. You can do it. You are ready at this moment. You are taking, you are so brave for taking this course during the 5th year.
Yeah,
It's a
it was
difficult moment of the career.
yeah.
So relax, relax. I see you stressed out.
I always stress out for little things.
No, don't worry. Relax, you can do it. You're ready for this. Don't worry.
Thank you.
Yeah, if you are not ready, you were not at this moment of the career, right?
You're right.
Yes. So let me prepare the homework to send the topics to the group and see you. Well, we are not coming tomorrow. You're going to go in class, right? In the
I'm sorry,
university.
what?
You're
Yes.
going to be at the university. So
Yes,
let me write down for not forgetting and asking for permission.
yes. I can only attend on Mondays and at this time on Tuesday and Thursday.
Okay, don't worry. If you have questions about the class, write me down, send me a message. I don't know whether it's gonna be as clear as the yesterday one.
Okay, thank you.
I think it was okay. Yeah, just going to the topic.
Yes, it's pretty specific.
Yes, it's better to make it in that way because if I start making unrolling,
You're never
there's
gonna.
too much information. So when I checked the program and I said, what? Oh my God, how can I prepare these classes?
Yeah, I had the same thought. I was like, how am I gonna see all of that in only 2 months?
Yes,
My whole
it's a lot.
career in 2 months.
Yes, it's a lot of information and it's just a general view of all of these situations. And of course, if we had more time, we could practice more vocabulary.
Yeah.
So patience. We have to continue. We started, we have to finish it.
Yes. We're on the way.
So I have a question for you. Considering the final test, it's going to be maybe on Wednesday.
No.
The final test of this module because it's gonna be a little longer than the first one. I'm going to prepare it to take it on Thursday because I have now 1, 2, 3 students that cannot attend it on Wednesday. It's enough for changing the day. Yes, yeah, you can do it. Yeah. Okay.
It's because I have a presentation tomorrow, but I think I can miss or I can escape for a moment to do the exam in case you can change date.
Let me see a solution. Don't worry about it. I'm going to find a way to correct it, okay?
Okay, thank you.
Okay, so go and relax. Relax, yeah. Okay, so I hope it's you Thursday. That's all. Tomorrow it's not possible.
Yes, thank you very much. Have a good night.
Okay, have a good night. Have a good class tomorrow. Bye.
Thank you. Bye.
Okay, so at this moment I have no answer for any other students. and the ones that are supposed to come usually don't come. 10:45. Well, Claudia finished her schedule. Bernardo finished her schedule too. They didn't come. So I'm going to close the workshop, and that's all at this moment. Bye-bye. See you tomorrow.